I'm Dr. Nakamura. I'm a board-certified plastic surgeon, having been in practice for almost 28 years. Originally, was born and raised in Japan. Came to the United States in 1965. Did my education here, mostly in Texas, graduating from University of Texas in Austin, and spent some time in Louisiana in New Orleans doing general surgery, followed by plastic surgery training back in Texas, and have been in practice in the Dallas-Fort Worth area for the past 28 years. I'm passionate about cooking and golfing, and plastic surgery, of course. Growing up in Japan, as a male child, I was not allowed to go into the kitchen. After I came over to the States, finally told my mother to teach me how to cook. And it's a source of relaxation for me when I get home. I mean, even though I work until 5 or 6 o'clock in the afternoon, I go home with a glass of wine and start cooking, and that's my relaxation time. I think I was born to be a surgeon. I can still remember in Japan in 6th grade, the class assignment was to dissect a fish. And they brought buckets full of carp. And that's when I knew I wanted to do just that, to be a surgeon, to dissect, etc. My operating facility is certified. It meets all of the criteria to perform any surgery that I deem safe to perform on an outpatient basis. If you look at my facility in the back, it looks just like a hospital. It's got all the emergency equipment. I think about just practicing safe surgery and staying within my limitations. And I know what I do well, and I don't veer away from that. I don't take risks, undue risks that would put patients in jeopardy. And my own standards are much higher than anybody else's standards that anybody else could set for me. We've learned that we don't worry about our competitions. We worry about ourselves. As long as we're doing a good job, we know that our reputation will grow, and I know that patients will follow. The procedures that I most perform are breast surgeries and tummy surgeries. Basically, these are mommy makeover procedures, but breast surgery involves simple breast implant surgery, as well as doing a breast lift with an implant. 90% of the time, I'm able to do both these procedures at the same time. So it is a great contouring procedure that does transform these patients, especially a devastating effect of a pregnancy or significant weight loss, weight changes, fluctuations. It does take devastating effect on women's bodies. And being able to bring their breast back up to where they belong, and make them more youthful and make them more full restoration of the fullness. It does a tremendous job of transforming these patients. Oftentimes, if you just do a reduction procedure, it does not really contour the breast to the shape that most patients are wanting. I do often do the reduction or mastopexy or breast lift with an implant at the same time. Plastic surgery to me satisfies both my right side and left side of my brain. And it is an expression of art. You just have a much less forgiving canvas to work with. It is a profession that certainly satisfies me, but at the same time, more satisfying is the fact that patients are so transformed, not only physically, but psychologically.